Welcome to the presentation on consent with regards to dental patients presented by Dental Elementary. In order for consent to be valid, according to the Department of Health guidance, the following criteria must be met. Consent must always be given voluntarily, and the person must always be appropriately informed about the treatment and the procedures. The person must have the capacity to consent to the intervention in question. Consent can be taken from the patient or someone with parental responsibility for a patient under the age of 18. We need to make sure that the person giving consent is not subject to coercion or undue influence. In Britain, we may face opposition to this by carers if they attend clinics with a generic form signed by the person with parental responsibility, saying that they can give consent for medical interventions. Although this may have been given voluntarily and with capacity, a generic form can never be informed and therefore is not valid consent. So what is consent? This is a definition given by the Department of Health, London, 1990. The voluntary and continuing permission of the patient to receive a particular treatment. It must be based upon adequate knowledge of the purpose, nature, and likely effects and risks of that treatment, including the likelihood of its success and any alternative to it. So why do we as dentists need to obtain consent? Obtaining valid consent is a fundamental legal and ethical principle. Gaining consent at times might be a lengthy process, but it has its advantages. Firstly, respects patients' autonomy and their right to self-determination. Second, it promotes beneficial working relationships between the dentist and their patient. Thirdly, it also reduces the risk of litigation. Here are a few common law principles to help you understand the importance of consent even better. The first one talks about how every adult has the right and capacity to decide whether or not he will accept medical treatment, even if a refusal may risk permanent injury to his health or even lead to premature death. It only matters what the person decides, whether it be rational or irrational. More importantly, the law takes the right of the patient to refuse treatment seriously. It does not follow that if a patient wishes to receive treatment, it must be provided. To help you understand this much better, autonomy and the right of self-determination do not entitle the patient to insist on receiving a particular medical treatment, regardless of the nature of the treatment. So as a doctor, you have a legal obligation to provide treatment, but this is not founded simply upon the fact that a patient demands it. There are other factors that come into play before treatment is provided. For example, can the patient afford the cost of treatment, or does the patient have health insurance which can pay for it? There are legal consequences of not obtaining consent. Common law has established that treating a patient without consent may amount to the civil or criminal charge of battery. More often, if a patient suffers harm as a result of treatment and it becomes apparent that the consent obtained is not valid, there will be a negligence claim. The GDC will investigate the clinician's fitness to practice. Now, talking about what is informed consent. Informed consent requires a full explanation of the nature, purpose, and material risks of the proposed procedures and the consequences of not having the treatment in a language that a patient can easily understand, making sure that no dental jargon is used. Litigation could arise from either A. Inadequate or false information being provided, B. Patients claiming they were not informed of all the risks. Therefore, it is imperative that the patient is informed about all the risks of any treatment being proposed. When a patient sits on a dental chair, it can be assumed that consent to an examination has been given. This is implied consent. Any invasive treatment or further investigation requires a discussion of the material risks involved, which this slide deals with. Practitioners must warn patients of any substantial or unusual risks. Each patient's individual situation must be taken into account. For example, risk of nerve damage when removing lower wisdom teeth varies depending on depth of impaction. Loss of anterior teeth to a singer may be of a greater consequence than to somebody else. Therefore, every patient varies. The General Dental Council's guidance on what information should be given to the patient. The patient should know about the options for treatment, the risks, and the potential benefits. The patient should also know why you think a potential treatment is necessary and appropriate for them. They must know the consequences, risks, and benefits of the treatment you propose. They must know the likely prognosis and your recommended option. The patients need to know the cost of the proposed treatment and what might happen if the proposed treatment is not carried out. The patients must know whether the treatment is guaranteed, how long it is guaranteed for, and any exclusions that apply. GILLICK competence. Now this applies to children under 16 and have sufficient understanding and intelligence and who fully understand the proposed intervention. In the case of GILLICK, which was a court case regarding whether a person with parental responsibility needs to be involved in the decision to prescribe contraception to a patient under 16 years, the courts ruled that you must ask the patient under 16 years to involve the person with parental responsibility in their treatment. However, if they refuse, you can take their consent as valid as long as they have sufficient understanding and intelligence to fully understand the proposed intervention. If you deem the child not to have this understanding, they are deemed to be a child lacking capacity, and therefore the person with parental responsibility must be contacted. The ability of a person to consent to their own medical treatment varies if they're under 18. The Family Law Reform Act of 1969 says that people aged 16 or 17 are presumed to be capable of consenting to their own medical treatment and any ancillary procedures involved in that treatment, such as an anesthetic. Consent will be valid only if it is given voluntarily by an appropriately informed young person capable of consenting to the intervention. The refusal of a competent person aged 16 or 17 may, in certain circumstances, be overridden by either a person with parental responsibility or a court. Young adults are another exception, as the age bracket of under 18 but over 16 is controlled by the Family Law Reform Act 1969. This states that anyone over 16 should have the right to consent to their own medical treatment. As we talked about before, a case in America has amended the Department of Health guidelines for this as a 17-year-old girl was refusing treatment for anorexia. This was overridden by the parents and taken to court, and the parents won. So, who has parental responsibility for patients who are underage? The child's mother, the child's father if he is on the birth certificate, the child's father if he was married to the mother at the time of birth, the child's legally appointed guardian, a child in whose favor the court has made a residence order concerning the child, a local authority designated in a care order in respect of the child. In the case of unmarried fathers, after 1st December 2003, they have to register on the child's birth certificate jointly with the mother at the time of birth, or re-register the birth if they are the natural father, or marry the mother of their child, or register with the court for parental responsibility. Although this initially looks complicated, as a general rule, anyone who has parental responsibility which has been given by a court will know and have the documentation, as it is a long process. Now, talking about consent when it comes to looked after children. But first we need to understand who are looked after children. According to the Children's Act 1989, Section 22, entitled General Duty of Local Authority in Relation to Children Looked After by Them, a child is legally defined as looked after by a local authority if he or she is provided with accommodation for a continuous period for more than 24 hours, is subject to a care order, or is subject to a placement order. If a care order is in place, the local authority will have parental responsibility and also be able to determine to what extent the parent or guardian may have parental responsibility. For example, the parent may have shared parental responsibility with the local authority of full or none, depending on the situation. Placement order is where the child is placed with prospective adopters, which is complex as they get parental responsibility shared with birth parent and local authority as soon as child placed with them until the adoption paperwork is complete. Gaining consent. On the pediatric department, written consent is usually gained for treatment under general anesthetic, or treatment under inhalation sedation, and even extractions under local anesthetic. General anesthetic. There are two waiting lists for general anesthetic in the UK: exodontia and comprehensive care. Talking about exodontia first. This is a waiting list for children requiring extractions only. Consent for extraction must be taken for teeth noticed in the mouth to have any decay, plus any other teeth as necessary, including anterior teeth, to achieve oral health. The consent taken here is not as accurate as it is going to be in comprehensive care, which is talked about in the next slide. Comprehensive care. This is a waiting list for both restorative and extraction cases. Consent needs to be as accurate as possible. Fillings and extractions as necessary is not acceptable unless the only way to examine the child is with general anesthesia. Example: proposed treatment, general anesthetic, and local analgesia for the extraction of at least one adult tooth and 4 primary teeth. restoration of 3 adult teeth, and any other restoration and extractions as needed to secure oral health. Finally, the summary of consent. Consent is about effective communication. It relies on total respect for patient autonomy. Assess the patient's competence to consent is really important. To consider the authority of the patient, example, are they over the age of 18? Providing the patient with as much information that is relevant in a manner they can understand and answer any questions truthfully and without any hesitations. Ensuring consent is given freely without any coercion or undue pressure. It is also important to consider whether written information and/or consent forms are necessary. And finally, keeping good records is very important. Here are the references from which all the information of this PowerPoint has been taken. Feel free to open these articles in your free time for a deeper knowledge. We have now reached the end of this PowerPoint, and I hope that everybody who has listened to this PowerPoint has a much clearer understanding and knowledge about consent. For further guidance and help on different topics in dentistry, head over to our website at www.dentalelementary.com. Thank you.